Hello, my name is Heidi Robertson from Accredited First Aid. As a former intensive care ambulance paramedic and experienced first aid trainer with accreditation in anaphylaxis education, I'm here today to talk to you about some of the issues surrounding beekeeping, safety-wise, and what you can do to keep yourself and others safe. This video will look at some of the safety precautions to consider to avoid being stung and what to do in the case of a sting. In addition to the information contained in this video, it is strongly recommended that you also complete a first aid training course, in particular including response in anaphylaxis and in CPR. This video is not intended to replace one-on-one first aid training with an accredited organisation. For viewers in Australia, ASCIA, or the Australasian Society for Clinical Immunology and Allergy, offer a free online course in anaphylaxis education, and further details of that course can be found on their website allergy.org.au. It's also recommended that you join a beekeeping group local to your area in order to keep up with best beekeeping practice. Bee stings are an inevitable part of beekeeping. However, there are some steps you can take in order to minimise your risk of being stung. What kind of temperament your bees have will partly depend on what particular species they are. When first starting out in beekeeping, it may be wise to keep a strain of bee that is more docile than aggressive, and you can check with your local beekeeping organisation regarding types or strains of bees and how to recognise signs of aggression in your bees. Bees are more attracted to dark, fluffy or woolen clothing, as well as brightly coloured clothing. So instead, choose to wear clothes that are lighter in colour and smooth, or even better, wear a protective beekeeping suit such as this one. Check to make sure there are no holes or gaps in your clothing prior to approaching the hive, and shoes with sock protectors or boots should be worn. Try to avoid bare feet, especially around flowering ground cover such as clover where bees like to roam. Strong, longer length gloves should be worn, as well as a protective hat with a semi-rigid veil so that the bees cannot sting your face through it. If you have long hair, ensure that it is tied up and tucked away in order to prevent bees becoming entangled in it. Don't approach your bees if you're wearing strong perfume, aftershave or deodorant and so on. And also avoid approaching them if you have other odours on you, such as from animals or fuel. Bees are more likely to be out and about foraging on warm sunny days, so these are the ideal conditions in which to approach your hive, and try to avoid approaching the hive on cold, windy or rainy days. Don't leave sweet drinks around. You may get a nasty sting in or around your mouth if you drink out of a can with a bee in it, and the pain from such a sting is going to be far worse than a sting on any other part of your body. Always use slow, considered movements around your bees rather than sudden or jerky movements. You can also use your smoker to calm the bees prior to approaching. Please watch our video on how to use a smoker safely. Always have someone with you when you are working with your bees. If something goes wrong, they can help you. A normal reaction to a bee sting is redness, swelling and itching around the injection site, along with a burning or stabbing like pain immediately following the sting. First, calmly remove yourself from the vicinity of the hive, as the bee that stung you may release an alarm pheromone which can encourage other bees to come sting you as well. They can also release this pheromone when they have been squashed, so take care not to squash your bees when you're working around them. Once you are away from the hive, remove the stinger as quickly as possible, preferably within 30 seconds. Pulling the stinger out may squeeze more venom in, so it is preferable to scrape the stinger out using a fingernail, credit card, car keys and so on. Place an ice pack onto the sting site to help with the pain and the swelling, but remember to always wrap the ice pack in a cloth and not put the ice directly against the skin. The next video in this series will focus on allergic and anaphylactic reactions to bee stings and the appropriate treatment. Accredited First Aid has also created a safety pamphlet available on the Flow Hive website covering bee sting safety. Be prepared, be safe and happy beekeeping. I'll now talk about how to recognise moderate and severe allergic reactions and what to do should one occur. You are strongly advised to consult with your doctor if you have suffered an allergic reaction to bee stings previously. If you have a diagnosed severe allergic reaction, also known as anaphylaxis, to bee stings, we do strongly recommend that you do not keep bees. Here we have an Askia anaphylaxis action plan. Askia, as we mentioned earlier, are the Australasian Society for Clinical Immunology and Allergy and are the Australian experts in the field of allergic reactions. These action plans outline the signs of mild to moderate allergic reaction and what to do in the case of an allergic reaction, and then the signs and symptoms of a severe allergic reaction or anaphylaxis and the steps to take. In an emergency situation, all this information is difficult to remember, so that is why we suggest that you print out one of these from the website allergy.org.au and have it prominently displayed somewhere close to your hive. A normal reaction to bee stings, as previously described, will hopefully be all that you'll have to endure. However, some people may experience a mild to moderate allergic reaction immediately following a bee sting or even developing over several days after the sting. A small proportion of the population experience a severe allergic or anaphylactic reaction to bee stings, which normally occurs within seconds to minutes after exposure to the bee sting. But for some people, rarely, anaphylactic reactions can happen up to hours after a bee sting. This table, taken from the accredited first aid safety pamphlet written for Flow Hive, illustrates the difference between a normal, a mild to moderate and a severe allergic reaction. If you are suffering a mild to moderate allergic reaction, after you've flicked out the sting, call for help. If you have a prescribed medication such as an antihistamine for your allergy, it is preferable that someone stay with you while someone else goes to get your medication for you to take. If you have a prescribed adrenaline auto-injector, such as the EpiPen, now is the time to locate it, just in case your symptoms worsen. The most severe form of allergy is anaphylaxis, which is a life-threatening medical emergency. Anaphylaxis following a bee sting is considered to be present when any one of the following occur. Abdominal pain or vomiting, difficult or noisy breathing, swelling of the tongue, swelling or tightness in the throat, a wheeze or a persistent cough, difficulty talking and or a hoarse voice, persistent dizziness or collapse, and children can become pale and floppy. Whilst a mild to moderate allergic reaction may include persistent or spreading redness, swelling and itching over several days, an anaphylactic reaction is more likely to occur within seconds to minutes after exposure and involves far more severe symptoms. A mild to moderate allergic reaction may progress to anaphylaxis. However, be aware that anaphylaxis can sometimes occur within seconds of being stung with little to no skin symptoms at all. This is why we suggest that you carry an adrenaline auto-injector, such as the EpiPen, with you at all times. If you've had a previous mild to moderate allergic reaction to bee stings, there is about a 1 in 10 chance of further stings resulting in an anaphylactic reaction. It's important to note that while antihistamines are very effective at treating mild to moderate skin conditions such as swelling, redness and itching, antihistamines will not prevent or treat anaphylactic reactions. The only pre-hospital treatment for anaphylaxis is adrenaline in the form of an auto-injector such as the EpiPen or your country's equivalent. When responding to anaphylaxis, it is recommended that you take the following steps. Move away from the vicinity of the hive and quickly remove the stinger. Lay down flat and do not stand or walk. If breathing is too difficult when you're in the flat position, you can sit. This is very important. There is a greater risk of a fatal outcome if a person suffering an anaphylactic reaction is allowed to stand or walk. If you're with somebody else and they have an anaphylactic reaction and they become unconscious, place them on their side in the recovery position. Administer the adrenaline auto-injector. This brand, the EpiPen, contains 1 dose only of adrenaline. The instructions are written on the pen itself as well as the Askia action plan. It can be self-administered or it can be administered by somebody else who's been trained in its use. It is recommended that you undertake training in the administration of an EpiPen prior to commencing any beekeeping activities. Phone your country's emergency services and request an ambulance, and then phone a family or emergency contact if they're not already present. Further adrenaline doses may be given if there is little to no response after the first 5 minutes if you have another EpiPen available. Transfer of the person to hospital via ambulance is necessary for at least 4 hours of observation, even if the person appears to have completely recovered. I'm now going to demonstrate how to administer an adrenaline auto-injector, in this case, an EpiPen. Okay, here we go. And don't worry, this is a training device. It does not contain a needle, nor does it contain adrenaline. To self-administer the EpiPen, first sit yourself down. Step 1, take off the blue safety cap. Step 2, hold the EpiPen like this. They call it the gorilla grip. Don't put your thumb on either end. This is because if you make a mistake and accidentally put the wrong end of the EpiPen to the thigh, you could end up accidentally injecting yourself in the thumb. The EpiPen is spring-loaded and has a strong recoil, so make sure you're holding it firmly. The place to inject it is your outer mid-thigh, so halfway between your hip and your knee. It is designed to go through one layer of clothing, so jeans, such as the ones I'm wearing, would be fine, as long as I'm not going over the seam and as long as there aren't any pockets in that region. It is not a swing and jab motion. You should hold it gently against the thigh, the outer mid-thigh, and press in until you hear it click, and hold it in for a full 3 seconds to ensure that the full dose is being administered. 1, 2, 3. I'm now going to demonstrate how to administer the EpiPen on somebody else. Step 1, take off the blue safety cap. Step 2, locate the outer mid-thigh and inject for 3 seconds. 1, 2, 3. If there is no adrenaline auto-injector available, sit or lie the person down, don't delay in calling for an ambulance, and be prepared to commence resuscitation or CPR if the person becomes unconscious and not breathing normally. This is why it is essential that you undertake CPR training prior to commencing any beekeeping activities. Some of the signs and symptoms of anaphylaxis can mimic an asthma attack. For example, shortness of breath, tightness in the throat and chest, difficulty speaking, a wheeze, and so on. If someone with asthma is also allergic to bees and has sudden difficulty in breathing, always assume that it is an anaphylactic reaction and administer the adrenaline auto-injector first, before their asthma medication, even if there are no skin symptoms. And you can see this stated at the bottom of the action plan. If you are in doubt about the severity of the allergic reaction, always administer the adrenaline auto-injector. We don't know of any cases of people dying from the unnecessary use of an EpiPen, but there are certainly cases of people dying because of a delay in the administration of adrenaline. Now that you've learned a little bit about anaphylaxis, it is strongly recommended that you take the following steps before you embark on your beekeeping journey. Number 1, keep your ASCIA action plan close to where you undertake beekeeping. Do the ASCIA anaphylaxis course online or find an equivalent course in your country, or complete a first aid course which will include CPR, anaphylaxis education, and of course other life-saving information. Also, remember to do CPR updates annually. And 3, follow the instructions in this information video, as well as following the instructions in your anaphylaxis training. 4, join your local beekeeping group and undertake a beekeeping course in order to obtain general guidance on beekeeping. Point 5, give this safety information to your partner, your work colleagues, your kids, your neighbours, and any beekeeping buddies. You never know when it could save a life. Accredited First Aid has also created a safety pamphlet available on the Flow Hive website, which covers anaphylaxis. Be prepared, be safe, and happy beekeeping.